Diagnostic evaluations are common treatments that's provided by most mental health providers. So in today's video, we are going to be discussing best practices when reporting CPT codes 90791 and 90792, psychiatric diagnostic evaluations. So let's take a deeper look into how to properly report these CPT codes for your practice. So if you are interested in learning more about this, then keep watching. So what's up, everyone? If you're new here, my name is Kat, and I am a certified professional medical coder, certified professional medical auditor, medical biller, and owner of Superior Medical Consulting, where we provide full service and a la carte billing solutions for your mental health practice. You can visit our website at superiormedicalconsulting.com to schedule your free consultation. And this is Level Up Medical Coding. Okay, so as I stated in the introduction, we are going to be talking about best practices when reporting psychiatric diagnostic evaluations or reevaluations. These diagnostic evaluations are covered or reported with CPT codes 90791 and 90792. So let's discuss the differences between the CPT codes 90791 and 90792. So we're going to go to the CPT book to get the information straight from the source. So I'm going to be reading from this. So psychiatric diagnostic procedures or diagnostic evaluations is an integrated biosocial assessment. Includes medical history, mental status, and recommendations. The evaluations may include communication with family or other sources and review and ordering of diagnostic studies. That's the foundational definition for reporting psychiatric diagnostic evaluation. So if that's all you're doing, that will be covered under CPT code 90791. On the other hand, if you are providing medical service in addition to what I mentioned before, then you will report CPT code 90792. Let's go back to the book. So, psychiatric diagnostic evaluation with medical services is an integrated biosocial and medical assessment, including history, mental status, and other physical examination elements as indicated in the clinical notes and recommendations. The evaluation may include communication with family or other sources. It may also include prescriptions of medication, review and ordering of laboratory work, or other diagnostic studies. In certain circumstances, one or more informants may be consulted when you are billing out these codes. And so, like I said earlier, family or other qualified persons that has to do with the care of the patient. So, when you are reporting psychiatric evaluations, you need to make sure that those elements that's mentioned in the CPT book is also, documented in the medical record, that you are some way, somehow incorporating that in the evaluation. So, at the very minimum, you have to make sure that you are assessing the patient's psychosocial history, their current mental state. You are reviewing or ordering any diagnostic studies, and you are trying to develop a treatment plan. That's the most basic components of these codes. So, in addition to these components, again, if you decide that you have to provide, or if you are a qualified provider that can provide medical services, then no need to build a separate E&M with these visits. You can report your E&M portion of the visit. It's an all-encompassing code when you report 90792. So 90792 gives you credit for those medical services like administering medicines or reevaluating medicines, physical examinations, ordering tests, reviewing or ordering diagnostic studies. So those are covered when you report 90792. So it is not best practice to report 90791 and then add an E&M code. If you have medical services that you are performing, use one code, 90792. So while we're talking about codes, let's talk about some coding tips for these codes. Typically, with these codes, you may have opportunity for additional reimbursements if you have some kind of complexity that has been endured during this visit. Communication complexities, you have, some reportable mandates that you will have to perform, as a result of this evaluation. There was some kind of language barrier, not to be confused with needing an interpreter, but some kind of language barrier, like the child is nonverbal, but they have like some kind of communications that you can get through to them with use of play equipment, for example. If you have such instances as that, you can report whatever appropriate diagnostic evaluation code will qualify for that visit, as well as an add-on code for interactive complexity. And if you need more information about interactive complexity, I do have a video on my channel about that, and I'll go ahead and link it in the cards, and I'll try to remember to link it below as well. But what you would need to know is that it may be an opportunity for additional revenue if you have to, incorporate interactive complexity in your visit. And then we'll talk a little bit more about that later when we get into documentation tips. Also, make sure that you are reporting the correct code. As stated earlier, you have those two codes, one with or without medical services. So just make sure that you are picking the correct code, for that visit. Now let's talk about some documentation tips. So it would be good practice to always document the time in and time out of the session with the patients. Even though these particular codes are not time-based codes, it's always best practices to report time in and time out of session, because it will correlate with your daily work, with your other encounters that you are, utilizing for the day. So best practices will be report when you saw the patient and when the patient left the session or when the session ended. Also, document who was all involved in this session and what would their roles be. So if it was just the patient, if it was just other people like the caregivers, the guardian, someone else that's, related to the care of the patient, then go ahead and report that. If it's a team of people, go ahead and report that. So best practices would be to always document who was in the session as well. Also, make sure that if you have a plan in place, that you document the plan, and also make sure you would document the expected outcome of treatment. You always want to make sure that you document in the clinical note the goals of treatment for, any therapies that may be given to the patient as a result of this diagnostic evaluation. Make sure that if you are utilizing interactive complexity, you document the type of methods that was used to overcome that complexity, whether it's use of play equipment, whether you had to contact, someone for like, some sort of elderly or child abuse, a third party mandate, maybe a probation officer or something like that. Make sure that you document if you had to use the play equipment, the reason why you did that. Maybe the patient was nonverbal. Maybe the emotions was high in the visit and you had, a number of parties or the patient repeatedly asking you the same questions, or was just really, really anxious, and, it just kind of hindered the session. Make sure you just document that very well. Also, make sure that you are understanding the medical necessity for these visits. So check with your payers always about how and when you can report these codes. A lot of times Payers only will allow you to bill out these diagnostic evaluations once per year, sometimes twice per year. Sometimes you can have the first two visits as evaluations because you need that amount of time to spend with the patient to kind of get to the root of the problem. So you just need to make sure that you understand your payer's rules in regards to reporting this code. So you don't want to have a frequency denial for these codes. You can always contact them yourself. You can always have your biller to contact them or whoever does the verification of benefits to contact the payer just to see how if there's a limit to how many times you can bill this code for your patient's plan. Also, make sure that, like I said, that there is medical necessity for this. If you are going to be reporting your F codes, your FDX codes, just make sure that it is a payable code, a covered code. If for some reason you don't have a definitive diagnosis yet, then you will want to report the signs and symptoms. So it's usually depicted with R codes. Make sure that those R codes are covered codes that will necessitate the medical necessity for these visits because our codes are a little bit harder to justify than F codes. So if you are unsure if they are covered codes, make sure you either contact the payer yourself or have your biller to contact the payer. See if there's any guidance on, your Max or your payer's website about that if you don't have the means to actually contact the insurance company via phone communications. So let's see. We talked about coding tips. We talked about documentation tips. So, reimbursement tips. So, make sure that you see if the patient's insurance coverage requires an authorization for these visits. If they do, make sure you get that authorization and make sure that you document that on the claim form that you received prior authorization for these visits. It's harder to retro auth something, so it would be best practices to get prior authorization if that patient's plan does not cover, mental health services. Most plans do nowadays, but if you are unsure, always call and verify benefits before providing treatments. Make sure that you stay up to date with the latest billing regulations for these codes. A lot of times, there can be changes, updates. You want to stay abreast of these, regulations. So, some references or resources that I use to make sure that I'm staying up to date is, of course, CMS, of course, the payer websites. They have your billing guides for your providers for mental health, codes. So make sure that you review those. Also, since I am a medical coder, I tend to go to AAPC. I got my certification through AAPC, so I use them as a good reference. Also, the AMA, you can visit ama.assn.org and you can, search their website to see if there's any updates that you need to be familiar with, that you need to, like make sure that you take note of. Also, the American Psychological Association, they have good resources, especially if you are a provider. You're more than likely a member of the association, but if you are a biller, you may be able to check out the website and see some of the information that they have available for free for the public. If you are a part of an organization, see if you're a provider, if you are a biller, if you're a provider, can have access to that. It will only help your provider's practice to, bill out things in a timely manner. It will help prevent claim denials. It will help prevent delays in reimbursement if you stay up to date on regulations for how to bill out psychiatric diagnostic evaluations. But I would say the number one thing is to always contact the insurance company prior to providing these services, especially if you are concerned about a frequency issue, and to also make sure that you understand the coverage for the patient for these services. Most practices nowadays perform telehealth visits. These services are typically covered under telehealth. Actually, in the CPT book, it is depicted that these are telehealth covered services. You can see that indicated along the bottom of the CPT book. In my book, is denoted with a star. And the star, if you look at the key in the CPT book, stands for telemedicine. So those codes are typically covered under telehealth. But if you are unsure, always check with your payer. Good practices when you are billing telehealth. Things to remember when you are reporting these services if they are performed via telehealth is that you need to have the correct place of service documented on your claim form. So place of service 02 or place of service 10 will be the correct place of services to report. Place of service 02 is for telehealth provided in places other than the patient's home. So if the patient is in their car, at school, at work, any place other than in the patient's home. Telehealth service 1010 are for telehealth services provided in the patient's home. So if you are providing services in the patient's home, use telehealth place of service 10. Always check with your payer though to make sure that you follow their guidelines for reporting telehealth. But in general, you will use 02 or 10. Also, there are some modifiers that you need to append to your telehealth codes, to your code when you are reporting that you have done these services via telehealth. Three of the most common telehealth modifiers that you will use would be the modifier 95, the modifier GT, and the modifier 93. You need to check with your payer to see which modifier they prefer. Modifier 95 and GT are pretty much the same code, the same modifiers. Some payers prefer the GT over the 95 and vice versa. So those are for telehealth services provided like audio visual. And you need to go ahead and make sure you append those to the codes because especially if you are reporting place of service 2 or place of service 10 and you don't have the modifier, your claim will be denied. So you don't want to have any delays and reimbursements because you forgot to put the modifier on there. Also, if you have some kind of trouble getting the video going and you've reported or performed these services pretty much via just voice, just like over the phone, you didn't utilize video. A lot of payers want you to report that service using modifier 93. So make sure you check with your payer policies, your payer rules to see one, if they allow audio only visits. And if they do, how do they want that reported? Do they want that reported with the modifier 93 or do they have some other modifier that they want that reported? So best practices would be to take a look at the payer's telehealth policy. Also, if you perform these services via telehealth, you need to attest to this. So you need to provide some kind of attestation in your clinical note attesting to you providing the services, how the services were provided, whether it was audio, visual, or just audio only. You need to state where you, the provider, was located. You need to state where the patient was located. You don't have to put a full address, even though that is encouraged, but you can put like, your at your office and at the patient's home. You can be general like that, but you need to attest that you provided these services. It's also best practices to summarize the length of time you spent with the patient during the telehealth visit as well, just to reiterate from the time in, time out. But that's best practices. You could do that. You could come up with your own company's policy on how your attestation is written, but it needs to be addressed in the clinical note. So just a last tidbit about reimbursement. Clinical social workers are able to bill out diagnostic evaluations. However, you will have to have an assignment of benefits, for this. So you need to contact the insurance company and just get an assignment of benefits stating that you're a social worker will be performing diagnostic evaluations for the patients. I know typically we have verbiage that Medicare payments are usually 75% of the fee schedule when these services are provided by a clinical social worker. So you may want to verify the fee schedule with your payer just to make sure that you are getting what you expect to get. Okay, so last but not least, let's talk about some coding and billing software that private practice providers can use. I know that a lot of providers that are just starting out in their practice are looking at softwares that they think will help benefit them when they are documenting, they are reporting, getting the claims out the door, connected to a clearinghouse and whatnot. So just some uh, the softwares that I have utilized and would recommend would be, and this is in no particular order, but Simple Practice has a good simple interface, that billing software that you can use. If anybody has any experience with Simple Practice, I'd be curious to hear about it. Drop them in the comments, let me know what your experience with Simple Practice is. But they are pretty much user friendly, and you can submit your claims straight through the software, as well as document, update your treatment plans, and all that, good stuff. Other softwares would be Theranest, Therapy Notes. Therapy Notes is also a good one. You can do pretty much the same things as all the billing and software pretty much allow you to, connect to a clearinghouse to submit your claims, get your claims scrubbed, and things of that nature. Also, house your clinical notes and update treatment plans and all that. Practice Q is another one. That is a billing software that I have utilized that works. You can also submit some of these claims straight through Availity or any other of the clearinghouses that your payer recommends, straight through your payer's website. You could also use Office Ally and Chorizio. So I'm trying to see if I want to use Chorizio for my billing practice for those providers that don't have a billing software already. So I'm testing them out, and maybe I'll make a video in the future about my experience with them. But yeah, that's just pretty much just some, some recommendations for some billing softwares that you may be interested in if you don't yet have a billing software for your practice. So to wrap everything up, we talked about the differences between psychiatric diagnostic evaluation codes 90791 and 90792. We talked about some additional opportunities for reimbursement if you should happen to have interactive complexity, within that particular clinical session. We talked about some coding tips. We talked about documentation tips. We talked about some reimbursement tips. We talked about some billing softwares. So those are my best practices when billing out psychiatric diagnostic evaluations. And if you are in the market for a medical biller, I would be happy to consult with you to see about being a part of your team. So we are currently accepting new providers at Superior Medical Consulting. We will be so ecstatic to work with you. If you are interested, please visit our website at superiormedicalconsulting.com today, and you can schedule your free consultation right there from the website. So I want to thank you so much for watching and supporting me to the end of this video. And if you stuck with me all the way to the end, I would love to know that you are still here. So if you would do me a favor and put in the comments 100, just so I can know how many people actually really stuck to the end. I'm always curious to know like who actually watched these videos all the way through. So put in the comments 100 and let me know. If you have any questions or concerns, please leave them in the comments. I would be happy to look at them and see how I can assist. And until the next video, I'll talk to you soon.